Budget making for the college or the hospitals. College of nursing. The budget word came from the baguette, the bag or the wallet. It is a French word. The man come with a leather bag to the parliament or somewhere. So with full of data and papers. This one later on becoming a budget. It's literally the French word. The budget is a concise, concrete picture of a total operations of the enterprises in a monetary term. So, your course you are starting, if a nursing course, it's a first year fees this much, it's a tuition fees this much, clinical is one, bus fees is this one, uniform fees this one. So, it's direct or indirectly this money is spending. The operation expenditure is telling in the way of how the course is running on. Same way, it's a simple picture which is clearly explaining the total operations which is happening in an enterprises or college or the industry. It's called the budget. The decision making is the heart of the budget. You and me can make a budget, but who will be the higher administrators will be take a decision because they are having the money in their packet. So, and while making a budget, you have to understand that scarcity of the resources has to be used in a wise way. That's what the budget is mean for. You have to understand the rule of lapse. The budget will be disappear or you cannot promote that one. You have to understand. Always budget will be looking, analyze the present and understand the past and looking predict the future. The scarcity must be understood. What are the different types of budget? There's an incremental budget, open-ended budget. You cannot fix it. Maybe that one fixed ceiling budget, this much only which is allotted for. Flexible budget, X or Y, some extra, we will keep it for that. Rollover budget, this budget remaining amount can be used for the next year. If you are in service education, you are not used this one. Performance budget, that capital budget is the total amount. Program budget, zero budget, especially in a community program started with a zero budget. Sunset budget, if you are not used self-destruct budget. Sales budget, production budget, revenue expenditure budget and cash budget. Still some more budgets are also there. The name is so much different. How this budget should be, how these features, before you are making a budget, you should understand the features of budget. Budget should be flexible. As I told you, it synthesize the past and analyze the present and predict the future. It's a joint cooperative executive department and HOD and other authorities together must make the budget, but decision making is the heart of the budget that higher administratives are taking it. They take your suggestion. It's not the thing they are going to take, but they take its suggestions. They will consider it. It is the statistical standard and numerical form, number form. It's having a support from the top level management, of course. Otherwise, it's not happening. It made annually. What is the principles you have to follow? Budget should be principles of publicity, principles of clarity, principles of comprehensiveness, principles of unity, then detailed specification and prior authorization, and then principles of accuracy and principles of flexibility is a very important principles. Before making any budget, you have to first analyze the budget. How do you analyze? It's from the different department or the hospitals. You have to analyze. What kind of analyze? Cost benefit analysis and cost benefit ratio and cost utilization benefit and the cost unit benefit you have to analyze. So cost expenditure analysis also you have to mean it's a direct cost or indirect cost or semi-variable cost or fixed cost or overheaded cost and committed cost and fixed cost will be some expenditure will be the consumable things you are buying. One building you are constructing, that's like a fixed amount you will put it, and some stationaries and other thing will be you will be making on and off. So when you made it last year budget, you made a building that this year budget it will not come because it is finished it. So the next budget, if you want a new building only, you will add it, or otherwise it will be deleted. So you analyze how this cost is being expenditure and various department what all the new costs are coming. You have to analyze. So while making, you have to know how the income are coming. If you take the hospital budget first, hospital income is coming. Hospital from the admission time, lab, x-rays, investigation, inpatient, outpatient, OT fees, surgery fees, medicine fees, doctor fees, nurses fees, diagnostic fees, room rent, nursing fees, and other expenditure. These are all the ways the income is coming. Expenditure in a bulk way, payroll for the very bulk budget, going for the doctors, nurses, pharmacists, telephone bill, rent, logistics, taxation, hospital, ward management, lab services, equipment, biotechnology, maintenance. One more thing, hospital waste management is a very important, it's very costly. So this is the income and the expenditure, revenue and the expenditure we are seeing it. Same way in a college also we can see same thing. Income, while application form, tuition fees, hostel fees, mess fees, scholarship, lab fees, sports fees, curricular, extracurricular activity fees, alumni fees, many things we are collecting. Expenditure, salary, huge amount going for the staff, logistic fees, then permission for the getting the posting for the government setup, visit permission, stationery fees, exam fees, library fees, and LED, you have to buy some journals, lab articles, some other miscellaneous. So you are already analyzing how the budget is going on, what all the departments and other things are there, what is the income and the expenditure in the hospital or income expenditure in this college of nursing. Anything, if you want to build a hospital or put a budget for the hospital or college of nursing, then you first follow this rule. So budget process you have to follow. First you understand what is the vision of your hospital, what is the mission of your college of nursing, vision and the mission. Review the existing program, what is the current program is going on, is that towards the objective is going on, or you want to make the vision more wider, extra, covering some more city, reaching our services throughout the villages and something. So expenditures are increasing. So analyze the manpower, mobilizing van or something you are going to arrange the logistic services in extra, that must be invested, that must be reflected in the budget. Then identify any alternative methods. Is there any alternative methods are available? One alternative, 1, 2 or 3, 4 alternative method which will reduce my cost. Then compare 1, 2, 3 or 4 alternative etc. and select the best alternative and implement it. Once you implement, you will develop the budget. How do you develop the budget? You have to develop the budget. If the hospital or college, that item you have to write it. The budget for in-service education, the budget for logistic, budget for salary, budget for wastage management, budget for taxation. That budget should tell, because I told you, budget is always analyze the present and understand the last year and predict the future. So what is the last year budget? How many lakhs you have spent for the inpatient service, buying x-rays or monitor or ink, scanning machines or the film, photocopy, whatever it may be, you are spending. In the current year, how much? Last year, how much? Current year, you know the difference, how much it is the expenditure. From the current year, you can put 5% extra, or it is 10% extra. You can put if the cost of living, how much it is increasing. Then you put your signature, current picture, and then it is the future budget. That's the budget you are making it for. So same way in a college of nursing, you can put it the budget for how much is the expenditure for what is the salary, logistic, last year how much, current year how much is spent for college of nursing, and running year how much it's going on, and future 5% extra. Understand? So what is the purpose? All this budget, why we are making? As now we can get the money and put it back. Why we have to make the budget? Budget we have to make it to recognize the controllable and uncontrollable cost, to enhance the fiscal planning, to enhance the decision making. It helps to formulate the college or hospital objective properly and utilize the resources. That's why I told you the budget is making for understanding the scarce resources, to identify the problematic area where the budget is very high, to helps the allocate resources, to helps to understand the rule of lapse, to allow the feedback. So this is how the budget has to make. This is a 5-mark question or 10-mark question, mostly 15 to 20-mark question asked for the MSc nursing students. How will you make the budget for the College of Nursing? If they are asking, write the definition of budget of this one, definition of budget, meaning of budget, and what are all the types of budgets are there, what is the principles of budget making, income and revenue of the College of Nursing, analyze the budget and the budget making process, review and expenditure and other process, you have to explain it clearly, and the income and expenditure, either the hospital they are asking or the College of Nursing, how the income is coming from the College of Nursing and what are all the expenditure. With the help of that, you have to make a budget which should clearly show the budget in last year, budget in current year, and the current finance year, current year and the future budget you are making for the next year, and with your signature. Thank you.